go.
Hi, everybody. I am Andra Annette, and welcome to this week's session of Healing from the Inside Out. And today I'm very pleased to introduce you to someone that I adore. His name is Tom Ingegno, Dr. Tom Ingegno, and he was in pre-med, and then he found East Asian medicine, and he's been an acupuncturist for 23 years. My tongue's asleep today. Sorry, Tom.
It's all right. It's all
And
right.
he's also into integrative medicine. He's a health professional, so he's really doing amazing things. He's from Charm City, so please help me welcome Tom. Dr. Tom, how are you?
I'm doing all right. I'm doing all right. We're having a slew of technical difficulties all day long, but it seems to be working now. So I'm very happy to be here.
Well, you're very, easygoing, so I like the way you just adapt, and I think that comes from working in medicine. You're in both Eastern
Yeah.
and Western medicine. You combine them, and I think that whole balance of
Yeah.
of Eastern medicine kind of helps you deal with these snafus, so to
So
speak.
sometimes it's more of the face I put on. There's definitely chaos going on behind the curtain, you know?
I have days like that too, I'm sure. So you started in pre-med. So
Yeah.
I think it's interesting. And I think the audience, because you do so many amazing things. I was looking at your website and
Yeah.
I said, wow, he's really got his hands in so many different pieces. And I was reading your mission statement and your
Mhm.
vision, and you're very aligned with who I am as a person. You know,
Yeah.
um, we really do focus on the same types of things. And I said, wow, this I just have a different approach. Certainly no acupuncturist, but you do so much. You coach, you do incorporate that nutrition. So how did you go from majoring in pre-med
Yeah.
to that shift? What was
So
that shift?
there was there was always a focus, and I think at the end of the day, right, however anybody gets into any kind of discipline that's trying to help other people live better lives, the goal is that, like, we're told, oh, this is how we do it, right? There's a certain kind of structural in society. Oh, you want to help people, you're going to go into medicine, right, that's the goal. Now, when I got to college, we were taking all the prereqs, your bio, your organic chem, your physics, and the things that you need to kind of like show them. And I'm starting to see that some schools don't even need certain tests anymore. But you need those things for med school. So you take your MCATs and those kind of things. And while I'm sitting in these classes, I'm realizing, one, that almost everybody in the room had like a near photographic memory. They could memorize anything. But in some ways, they lacked what I think was emotional intelligence. They lacked the ability to
Empathy.
connect with somebody,
Yeah.
right? I mean, and I mean, you've seen it firsthand. You're in a hospital setting, and you see the doctor go, okay, well, you said this and this. Here's the answer.
Mm.
But that's, it's not necessarily that they're asking for what pill do I take, or what procedure do I get, or where do you turf me to. They're asking for a connection that's human based, right,
Absolutely.
and when we miss that specific part can ruin the whole healing relationship, right? So
Absolutely.
it's
And the
it's not.
healing process.
Yeah. And even when we talk about evidence-based medicine, right, we need those like peer-reviewed, double-blind, placebo-controlled studies to tell us kind of where to go. But we also need to count on the practitioner's experience, and then, probably more important than anything, is what that patient wants. How do we meet them? And I felt like, if we became robots and we just kind of memorized everything in the book and we spit that back at the appropriate times, yeah, we're doing medicine. But are we really serving people the way that they need to be to kind of address all aspects of their life, right? Certainly, oh, we go here for our mental health, we go here for the physical stuff, we go here for, but what looks at that whole person as a single unit, right? And that's where we start to talk about functional medicine. That's where we start to talk about integrative medicine. But East Asian medicine and a lot of the traditional practices never divided the body up like that. Yes, they know, oh, this is the stomach and this is the heart and this is
I
the
get it.
head.
You're
But
talking my life.
when you're looking at people and you're seeing only that one little sliver, yeah, when we're diagnosing something, we want to give a drug or we want to do an operation, we want that tiniest bit, and we want to be able to modify that, take it out, or do whatever we need to do to help heal that patient. But there's still all this other attached to that person, not just that physical bit, but their emotional component. What does this emotional, what does this disease mean for this person's emotion? What is this person going through mentally because they're suffering with X, Y, and Z? And Chinese medicine has always, and I say Chinese implying all of East Asia, has always looked at the emotions. It has looked at even like spiritual components of that. And that got cut out of medicine, right? Why? Because that's not something we can put our hands on. That's not something that we can see a number for.
But it's an amazing piece, and that's why I started this show, because there's a lot of people online. There's never been a time in ever in the world when there's been so many health gurus out there and more people are sick.
Yeah.
We
Yeah.
have the highest rate of disease. And it is really because people are trying to niche down and they're separating the body. So when I started this show, it was to tell people it's the same person you're treating, the spiritual, the emotional, the physical.
Mm-hmm.
So you're speaking our language, and as nurses, they embed in us that we are treating that whole person.
Yeah.
You and the family for many parts of it, because that family piece is part of it too, that support system. So I love what you're doing, and I love your ethics,
Mm-hmm.
because those are pretty clear on your website, where you're coming from as a person, and that empathy is very present. And a lot of times that's lost, because you do have to have empathy and compassion to
Mm-hmm.
really want to understand what the patient wants, because a lot of people for so long in medicine have been telling people this is what you need, this is what you need, but
Yeah.
they let these people go home and not, they're not even aware if they can eat those kind of foods,
Yeah.
it if they can afford those kind of foods, do they live in a place that has access,
Access. Yeah.
or can they afford it? So and they're just sending them off, and people are not getting better. There's people all over the world that are being given medicines that well exceed their financial intake, and they're
Yeah.
choosing to eat or medicate. So there has to be that whole body that you're doing. You do cryotherapy, which I
Yeah.
love.
Yeah.
There was something there, I don't know if it was the red light therapy,
Red light therapy. Yeah.
or something else that you're doing that actually heals sinusitis. And I was like,
Yeah. Yeah. So that's our salt pod. Yeah. Our salt
oh
cocoon.
my God, I've
Yeah.
suffered my whole life with
Well,
sinusitis.
one of the things when we're looking at these, what we'll call the modern therapies, which is kind of funny because salt caves has been used therapeutically for thousands of years. I believe, and oh God, I'm going to say this, and you're going to get some negative feedback from, no, that wasn't there. But Hippocrates even wrote about them. So this was a treatment a long time ago for respiratory disorders. A Polish physician in the, I want to say mid 1800s, he was sent to a mining town to practice. And he noticed something odd that was not in any other mining town, which was those miners not only were not getting sick, they had less seasonal allergies. And these are people that are in a cave, and we think like, black
You're
lung,
breathing in
right?
the
Yeah,
dust,
that,
yeah.
like, oh, they're getting it. Well, it turns out that that was a salt cave. So the dust that they were breathing in was actually therapeutic. Now we
Wow.
know one of salt's actions is when it hits the mucous membrane, it dries it out, pulls inflammation out of that, breaks up the mucus, but it also dries out certain bacteria, right? So it doesn't kill everything, but and these are the rules of osmosis here, right? So it goes from a higher concentration to a lower
Okay.
concentration. So it pulls the water out of the cells of certain bacteria and kills them. So he started sending his patients who had respiratory disorders, who had asthma, allergies, bronchitis, into those caves, and they were getting better. And this was in the 1800s. Now we have, like I said, back thousands of years where Romans were using it, Greeks were using those caves for something similar. So even though our salt cocoon is this modern day device with a fan and heat and all this, it really harkens back to like old therapies that applied and ran on, basically, I hate to say this, it sounds kind of trite, but the laws of nature. Cryotherapy, I mean, we're exposing you to cold. We're giving you a short, strong blast. Why? Because modern day life doesn't matter if it's winter or summer. You're going from your house, which is climate controlled, to your car, which is climate controlled, to your job, which is climate controlled. And there might only be 30 seconds in between that time you're in your car to your house and your car to work. So you're not really getting that exposure to those elements. So our bodies, which were designed to be out in nature, and I love AC, so I'm not knocking this, but we're not getting those pushes anymore. So we're kind of a little, and people sometimes get upset when I say this, but we're just advanced primates. We still are natural beings, as as crazy as we are sitting here on this phone call, quote unquote, in front of a computer having this conversation at a distance. At the end of the day, we are still mammals. We still need exposure to these things. So even my red light booth, right, sounds super fancy. There's at least 40 years of research on it. And that red light signal, that spectrum of light, you get high doses at morning, early morning sunrise and late afternoon sunset. We're not outside during those times. Or if we are, we're looking through a window. So we're not getting this natural stimulation. So in my head, even though these things are techie and new, they really do sound like traditional therapies. And they're all about creating a balance in the body, which is kind of if we had to say one line about acupuncture, that's what we're trying to do, create a balance. So in my head, even though we put together all these crazy services, it is
they're not
East Asian
crazy
medicine.
services because they are backed by a
Yeah.
lot of science. Even the cold therapy that
Yeah.
stimulates hormones that aren't active. People that have growth hormone issues and they're
Absolutely.
overweight, that stimulates that growth hormone and gets them to release those endorphins, the norepinephrine and
Yeah.
epinephrine, and it stimulates the body in ways that most people can't imagine. A lot of people can't feel like they can't tolerate it, but
Yeah.
they'll douse their body in cold water at the end of a shower.
Yeah. Well,
Andy
this
Frisell teaches that.
this is such an interesting time to be around, because now the research is reinforcing some of these fundamental things that we used to do for thousands of years. And there's different levels of entry, right? So if somebody doesn't want to come and climb into a 37-degree tub, yes, splash water on your face, cold water on your face, go in the shower for 10 seconds on cold.
I've been in a booth where they did that.
Yeah, that's cryotherapy. If it's dry, it's cryotherapy, and it's normally either an electric cooler like a meat locker, or our unit uses liquid nitrogen to achieve that cold temperature. And our unit is open at the top. Your head's out, so it's a little less claustrophobic for some people that don't want to go in that. But the stimulation is the same. The idea is to quickly constrict everything at the surface, to squeeze out blood that hasn't been circulating. You do get that endorphin effect. You do get that rush from the treatment. And then when you come out, your body's natural response is to want to warm up tissue so quick. So it does that by quick vasodilation and pumping blood back to that tissue. So you got this 1-2 like pump mechanism. And that's going to take care of some of the physical. People say they sleep so well after that. That's that rush that you're coming down off of. And then, I mean, you mentioned weight loss, you mentioned lowering inflammation. These are all things that we see with long-term use with it. And I tell people, first and foremost, we're not a weight loss clinic. If that's a side effect of the treatment, that's great. But most people are coming in
For
for
pain,
pain,
inflammation,
mental health, and a healthier
anxiety,
lifestyle.
depression.
Yeah,
Yeah, it helps with all of that. So
yeah.
yeah, I think that's great. And I also saw that you do massage therapy. Do
Yeah.
you do like what kind of massage
So
therapy?
I think that's what differentiates us a little bit, right? Because if you read our services, we sound like a spa, right? And that's not our aim. And we're very careful with the words that we choose, even on the website, because I think people get this idea in the head that a massage, and now I want to drop into my Long Island accent. I've been talking to you too long already. But within that, therapeutic massage has been around for thousands of years. Even Swedish massage, the one that we associate with the oils and the fluid movements, it 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 was designed to treat athletes. It was designed for a recovery tool. And now we go, oh, the spa's doing this massage. It's something I'm going to treat myself to, rather than, hey, not only does this lower inflammation, it stimulates parasympathetic nervous system response. We're seeing this effect throughout the whole body. And then that element of human touch. Technology is great. Like I said, we can have this conversation right now, but it doesn't replace that human connection.
Not at
So
all.
we get all of these things from massage that we think is just like, oh, I went in and I got a mud wrap and a light, effleurage, and I feel nice and relaxed. Yeah, that's all fine and good, but we can actually, and our massage therapists really want to specialize in that therapeutic. Tell me what you need me to work on, and let's work on that
I've
together,
had
right?
a really good stone massage.
Yeah,
This woman did
yeah,
it with hot stones. It
yeah.
was amazing. I felt
And
amazing. Like a week later, I was
even
still
even
feeling it.
that, people are like, oh, that's spa, and it's like, no, we're using
No,
heat. And most of those stones that they use, they when they get heated, they emit like a
they were
far
hot.
infrared signature. Yeah. So that far infrared signature stimulates increased circulation. It has all these extra benefits to help kind of flush out the tissue as well. So even when they're like, oh, that's a spa because it was hot stone, no, this has actual therapeutic effect that's been studied and can help people recover and heal.
So I know you do the nutrition, you coach people through nutrition as
Yeah.
well. So based on what they come in with,
Yeah.
you help them with the nutrition
So,
component of what you're
yeah.
treating
So,
them for?
yeah. So, when we talk about it from East Asian medicine, and I actually have a functional nutritionist who, oddly enough, she hasn't been in my office for about a year and a half. Her husband got a scholarship. This is so weird, for a film school in Estonia. So she works remotely out of Estonia right now for us, and she will order lab work and look that over and talk about the patient's goals. She doesn't want to just do weight loss. She actually wants to do functional things, whether it's skin issues or chronic inflammation, autoimmune disorders. And she'll work with them based on what their goals are, what their blood work says, and what food sensitivity tests are, and help them put together and I think we have this concept. Diet never meant, oh, I'm going to go on this thing called the diet for a few weeks. Diet
No,
was the sum total of what we're supposed to eat as humans,
correct.
right? And that's what she's training people to do. Now, if we talk about it from an East Asian medicine side, just like the herbs have properties, they go to these channels, they work on this function, they would assign those to foods. So they would diagnose the person based on their constitution and say, okay, these are the foods you should avoid. These are the foods you need to increase. That being said,
Like Ayurvedic medicine?
pretty much the
Okay.
same. Ayurveda has three different doshas. Chinese medicine will break things up either into 5 elements or 8 principles, all once again trying to strike balance within the system. We know those two systems influenced each other, but they're not exactly one to one, right? You don't call the things the same thing. They don't exactly behave the same. But I will say, in my 23 years, I do not personally, I always want to refer out to a nutritionist. because I
Thank you.
joke. Well, no,
Thank you.
I joke that like it would be easier for me to convince somebody to convert to a different religion than it would for me to get them to change what they eat. I also feel like you can be a jack of all trades and a master of none. Chinese medicine is a huge animal. So acupuncture is only one lane, herbal medicine is one lane, nutrition is one lane, diet, exercise is one lane, and we would talk about qigong, meditation, these kind of things. Breath work is all in those systems. It's all part and parcel of Chinese medicine, and I would even say modern medicine has been assimilated into Chinese medicine.
Yes.
But you know, no practitioner is knocking it out of the park with every one of those aspects. So
No,
certain
they
people are known
can't.
as herbalists, certain people are known as acupuncturists. I tend to lean heavily into the acupuncture, and I would rather have somebody that wears that nutrition hat 24/7 doing nutrition. I also feel like people need to be ready to hear that, right? They're okay laying down for an hour and getting something done to them. And you know when they're ready. Like, well, they call you when they're ready. Hey, this is
Yeah,
time.
I'm dealing with someone right now who's just not there yet. And
Mm-hmm.
I'm not even going there because I know she's not ready yet.
Yeah.
I'm available when you are. But I think like you do different therapies, we do have our favorites. Like I've been a
Yeah.
nurse forever, so nutrition has always been part of nursing. And
Yeah.
then I went on to get board certified, to
Yeah.
be a
Yeah.
holistic practitioner because I thought it added, and especially with everything that's going on in the world. But it's the nurse that really helps them with the nutrition,
Yeah.
not
Yeah.
vice versa. But you also wrote a book, and I don't want to lose
Uh,
sight of this
yeah.
because
Yeah.
you have so many qualities about in you and what you do and what you're out there in the world adding. So, and this is really important because there's so many people out there suffering with respiratory
Mm-hmm.
issues, especially this time of year,
Yeah.
but chronic issues like the asthma, the bronchitis.
Mm-hmm.
So you wrote a book. It was on cupping, I believe.
Yeah. Yeah. So
Tell me a little.
it's literally called the cupping book because I wanted to make sure we hit that nail directly on the head. But the idea behind the book was as I've practiced longer and longer, and I think you see this too, there's plenty of things people could or should be doing at home. And it's not that they're not willing. A lot of times they just don't have that basic knowledge. Now, cupping for me is great because Chinese medicine has been using it for thousands of years, but it's not even Chinese in origin. And it may have come from Egypt, it may have come from Greece, it may have come from Persia, but the one common thing is it was done in households. So this was self care, this was home care prior to going out and seeking physicians or expert opinions or treatment elsewhere. And, traditionally what they would do is they'd create, a suction in a glass jar or, bamboo, buffalo horns, clay pots, and using fire to burn the oxygen out and stick that to the surface of the skin. Well, grandma used to do that. It doesn't matter whose culture you're from. There was a grandmother in your family that probably did that at one point.
Mm.
Now, uh, because of the advent of plastics and silicone, we have all of these tools that are one, relatively cheap, two, very durable, and three, we've removed the risk of like fire because we don't need the flame anymore to create the suction. I'm literally playing with the suction cup as we're talking. So this is just a little silicone cup. They come in all sorts of colors. But when we want to create that suction with cupping, we literally just push down and then we have something that adheres. Now, the suction itself is the method of action to create change in the body, right? And what we're doing from an anatomical level is we're pulling the skin away from the fascia away from the muscle, and creating a space. So we know that, like, when people have pain, two things are happening. That fascia has little adhesions in it, and then that muscle might be very tight.
Yeah.
So when we do this and we create that space, because it's a relatively closed system, fresh blood has to get pulled through that tissue. right? So we're going to pull some of the waste product, whether it's, metabolic waste, whether it's lactic acid, cytokines, which are inflammatory markers, into that interstitial space between those tissues. But fresh blood is going to come in behind it. Fresh blood is going to have the nutrients, the oxygen, the things that tissue needs to repair. Now, even a mild suction like that has an impact on the body up to 6 inches, right? So you mentioned respiratory disorders, which is one of the big classical uses,
That's
because
how we learned how to use it as
yeah,
nurses, but we didn't do it with suction. We actually used our
our
hands.
hands,
So
yeah,
suction's so much better.
yeah, and I will tell you, they now sell like a silicone cup that's got like a little handle, and you would slide it between your hands so you could do the banging on the back of the chest. It's very funny because people go, oh well, this isn't, this isn't from our culture or something like that. If you've ever seen The Godfather Part Two, like it's literally Fredo as an infant. They describe him as sickly, right? He's the scrawny guy that gets bumped off at the end. I hope I'm not spoiling that for anybody, but it's been around since like what, the 70s, right? So catch up or just move on. But within that, there's a scene where they're describing him as sick. They flash back to him as an infant on the kitchen table, which I mean, God, yes, the movie's about Italians. That sounds like the most Italian thing I've ever seen. Grandma Nona's coming over with a glass jar, like a little, like, wine
Hmm.
glass,
I
and puts it
remember.
right in the middle of his sternum, right? And that was a traditional Italian way of doing cupping, and that was one of the big indications was respiratory health. Now, clinically, most people come to us, we see a lot of weird stuff. We see a lot of autoimmune, a lot of chronic inflammation. Pain is one of the big reasons that we use it in our clinic. Why? It lends itself beautifully to being attached to big muscle groups, traps across your back, the erectors, the glutes, your hamstrings, your quads, even your calves. We can get cups on, and really increasing circulation through that tissue is a way to flush that out and allow it to repair itself. So it's a quick and easy thing. And my intention with the cupping book was to make it a no nonsense. It's only 131 pages, cover to cover, approach that if your grandmother was teaching you how to do it, this is what she'd tell you, right? We reference a couple of studies, but I want it to be immediately accessible to people. I don't want it written at hey, you need a graduate level in healthcare to understand it. I want you
No.
to be able to go out and here's the cups that are available to me. This is what I'm doing. Here's a little bit of the history. Here's where we put them. Here's how we keep it safe. And here's how we take them off and get at it. Because my mentor, who passed away a few years ago, always was saying, look, for us as clinicians, we need to know as much as we can about the field. But at the end of the day, if it's not practical, if we're not doing it in a way that's meaningful to the patient, what's the point? So to be able to put this back in people's hands and empower them has become a mission for me, because I'm realizing I could burn myself out in clinic 7 days a week, 24/7, if that was even possible, and just treat people all day long. But I won't have the same impact as if I share knowledge, right? Because that knowledge, like
I love
I
that.
die, the book still goes on, the information's out there. That book can be passed on. People can go order that off of Amazon, and immediately now they have that knowledge. So that lives on, right? And this is how traditional medicines traditionally were passed on, right? I taught you, you taught somebody else, did it. So to have the impact is, for me, was to put it in writing and share that.
I think that's amazing too. And I think that we are giving them accountability for their health. We're giving that
Mhm.
back to them because they should be accountable in their own health. And a lot of times they misplace that trust in
Yeah.
themselves, and nobody knows your body better than you. So of course there are certain things we always need to go to doctors with, but
Mhm.
we've gotten very away from what health really is. And a lot of it was taught to us so long ago.
Yeah.
And it's become a very different scenario. And it was these practices that really kept people healthy and
Yeah.
functioning and home with their families. So I love that you're doing what you're doing, and I love that you're teaching people to revisit these properties. There's so many people out there that would really benefit from cupping, not just the respiratory, the pain that you
Yeah.
mentioned. And there are certain autoimmune diseases that I know that we've used them on in the past, and they were very effective.
Yeah.
So I'm kudos to you. I did want to find out if there's another book in your future, maybe, because you
Um,
do have a very vast knowledge. So a lot of people aren't, even though they're an acupuncturist, they're not equipped with the same techniques that
yeah.
you're using. You're really doing a lot of integrative health, and a lot of people, when they talk about integrative health, they talk about working with other different
Yeah.
practitioners that are really aligned with that. But you've taken a lot of time to educate yourself in them as well.
It's interesting because both of those definitions that you just gave are critical, right? You need to have a team of people that are all looking at that same person from a different angle to really get a full view. Um, our goal was to not sidestep that. And I have some functional medicine practitioners. I have a great network down here in Baltimore that I refer to regularly. But if I see you as a patient and you come into our place and you're making progress in one of our services or a combination of our services, we have the ability to then fine tune that or go, okay, I think you hit the mark here. Let's try and stimulate your body this way to see what we can get out of it. So it allows us to refine and play with a person's health until we get it to the point where they're happy with it. And
Yes,
then the discussion becomes, and we have a membership like a gym. And the reason we do that is because we know that you can't just go to the gym once and expect to see results. And that's the same thing with your health, right? Overall health. So somebody will go and they'll get a green smoothie and they'll go, "Oh, look at me. I had this green smoothie. I'm healthy." And it's like, well, that one that one smoothie is not going to offset you what 40 something years of eating the wrong stuff.
absolutely not.
But with continued diligence, frequent checks in with yourself on your health and looking at what else you can do, that's where you see the long-term health, right? So in Chinese medicine, they would call this concept yang shen, which means nourishing life. So it's not just about getting through and, having the big paycheck job and just, plowing through everything. It's what am I doing to restore my health on the daily when I'm out there exerting effort and being under stress and those kind of things, right? Self care is very important, but I think adopting a healthier lifestyle is what we're aiming at. And I feel like our
Absolutely.
center was my attempt to say, here's how we do that from the traditional health side, traditional health practices side. So let's keep you coming in regularly. And that regularly is different for everybody depending on their individual needs. But if you have the membership come in, even if nothing is going on, maybe we could sidestep something down the road.
I love that. So I'm going to ask you what I ask all
Yeah,
my
yeah.
guests.
Go ahead.
If somebody wants to reach out to you, what is the best way? I'm going to leave your links.
Yeah.
So they will have that, but I want him to tell you sometimes things get
Yeah, yeah.
misinterpreted.
I got you.
What's the best way to really reach out to you? Because
So
you are on social media. So go ahead.
people do my social media for me, but occasionally I pop on and go, oh God, this is why I'm not on it. But within that, our hub is our clinic website, which is Charm City Integrative, TIVE.com. That'll show you information if people want me to come out and lecture, teach classes, those kind of things. My bio's there, links to my resume, my press kit. Our book is thecuppingbook.com. That's available Amazon and every other online retailer, but thecuppingbook.com, if you want to go check it out beforehand, there are links on charmcityintegrative.com as well. My podcast, which is linked on my website as well, is called Irreverent Health. And you can find that at irreverenthealth.com. My friend Matt Hampton and I started this kind of in the middle of COVID, because we were having these conversations about health that didn't fit into, here's what the blood work says, or yeah, here's things that we should try on our own. What do you think about this crazy practice I've heard of? And we really want to look at it with an open mind and say, is there evidence there? And should I be doing this? And Matt and I found a lot of great, practices that we've adopted because of that show. And we've had some great conversations with other practitioners. So yeah, check that out too.
I love it. If you could tell the audience one great insight that you've had from your 23 years of practice, what would that be?
So it's one, it's never too early to start. So it doesn't matter how old you are, your health levels, you don't, it's not that you're going to cure something necessarily, but you can always feel a little bit better. So taking those little steps to move in that direction does yield benefits. And then I guess the other thing is you have more power than you know, right? We're no longer in this age where the guy with the white lab coat gets to dictate everything that's done with you, especially when you have a phone in your pocket that knows more than anybody else on the planet. So you have the access to the information. What you choose to do with that, of course, should be guided by people that have some healthcare experience. But within that, there's steps you can always take at every level of your individual health.
I love that. So it's been absolutely great having you. I hope you'll come back and revisit us
Yeah, sure,
again.
sure.
I just want to thank everybody for joining us today and thank my special guest, Tom Ingegno, for coming in. Dr. Tom Ingegno. I keep leaving that out.
Don't worry. It's a doctorate in acupuncture and Chinese medicine. Half people
But
think
yeah,
isn't real anyway.
Listen, you work hard for it. You earned it. You earned it. So you got to have it. So I want to thank you guys for coming in, and I hope you have an amazing day. Take care.